Hello, good afternoon, Pnawn Da. Today, as usual, I will give an update on the latest information about coronavirus here in Wales. I'll also set out some detail of our plans to enable people to visit relatives living in care homes. The broad situation across Wales remains stable. Overall, the 7-day incident rate for Wales is around 175 cases per 100,000 people. But we are starting to see some worrying increase in some areas. The rate for Blaenau Gwent, for example, has risen sharply over the last week. And we've also seen rises in cases in the neighbouring areas of Caerphilly, Torfaen and Newport. Perhaps most worryingly of all, as you can see in the slide, is the growth once again of cases in our under 25 population. Over the last 7 days or so, we've seen a rise in the number of younger people contracting coronavirus in most parts of Wales. And this slide shows on the left the all Wales under 25 rate. You can see how it's fallen during and after the firebreak, but has now started to rise again. It also shows the over 60s rate, which at the moment overall is continuing to fall. We know from the pattern of the pandemic so far in Wales that infections in younger people quickly work their way through the community and into older people. Older people are more vulnerable to serious illness if they catch coronavirus, and sadly at greater risk of being admitted to hospital and dying. The power to keep the spread of coronavirus under control rests in all of our hands. It's in the many decisions that we make every single day. Should I go out and meet friends after work? Or should I have a chat with them online, or even in the old way, on the phone instead? Should I work from home this week, or should I drive into the office every day? Should I go out for a meal and drinks at the weekend, or just go out for a meal? The more contact we have with other people, the more normal things we do, and that's the old normal, the greater the chance that we either catch or spread coronavirus. That is why we ask everyone not only to follow the rules, but to do everything we can to reduce our contact with other people as much as possible. And this is how we can keep ourselves and our families safe. I want to give a brief update about the mass testings pilot, which started in Merthyr Tydfil this weekend. There's been a great response in the first few days from people living in the area over the weekend, with more than 2,000 people tested. The initial results suggest a positivity rate of around about 1%. I want to encourage people living and working in the area to keep on coming forward for a test. And we will be opening new testing sites in Vaughan and Dowlais over the coming week. I want to thank Merthyr Tydfil Council, Cymtath Morgannwg Health Board and our military planners for all of their work, which has been achieved in such a short space of time to set up this pilot, and ask the people of Merthyr to keep on supporting the Team Merthyr approach. I now turn to care homes. Since the start of the pandemic in March, we have worked hard to protect people living and working in our care homes. People living in care homes are some of our most vulnerable people in society, and we've taken extra precautions to keep them safe. Just under half of Wales adult care homes have not reported any confirmed cases of coronavirus in either residents or staff since the start of the pandemic. We want to keep it that way because we know just how devastating it can be if coronavirus gets into a care home, as we've sadly seen in Llangollen recently. We have made a wide package of support available for care homes, including free personal protective equipment. Around 225 million items have been provided to social care since March. Extra funding to help providers and local authorities to meet additional costs, extra staffing if needed, weekly testing of care home staff, advice and guidance about infection control, the flu vaccination programme and the enhanced statutory sick pay scheme to support social care staff who have to self-isolate. One of the most difficult issues that we all have to deal with, but particularly families and loved ones, have been the restrictions on visits to care homes. Today we're announcing 2 schemes that could help to reunite families, many of whom will not have seen each other for months. We're working with 15 care homes across Wales, which we hope will take part in the UK-wide pilot to test visitors using the new lateral flow devices. These tests give a result in about 20 minutes, and they're the same devices we're using in the Merthyr Tydfil mass testing programme. These tests will give home managers extra confidence and reassurance that visits can go ahead without coronavirus also being imported into the care home. These tests do not replace all the other measures, such as infection control, social distancing and hand hygiene, which are so important to preventing the spread of coronavirus, especially in care homes. The pilot will start next Monday, and if successful, it will pave the way for a wider rollout to more care homes from the 14th of December. The second part of our plan focuses on providing care homes with more space to enable visiting to take place. Many homes lack the room for visits. We're therefore providing £3 million to install temporary pods at 100 care homes. We hope that 30 will be ready to use before Christmas, and the funding includes £1 million to support homes which prefer to make their own arrangements on a similar basis. We all know how difficult this year has been for people living in care homes and their loved ones. We're working hard to find a way to safely reunite families. I want to place on record my continuing thanks to staff who work in the sector for everything they have done over the course of this year, and to local authorities and the independent providers for working so closely with us. Thank you. I'll now take questions from journalists, and as usual, all the answers will be broadcast live on our social media channels. And the first question from today comes from Felicity Evans from BBC Wales.
Minister, thank you very much. I know that talks between the governments of the four home nations continue over the arrangements for Christmas, and you explained yesterday that there would be more talks this week. But nevertheless, some details of what's being discussed do seem to have emerged, including that there is talk of being more generous in terms of household mixing that's allowed for a period of between 3 and 5 days. Can you confirm that that is on the agenda, and if so, what is the Welsh Government's position?
Well, we are discussing the potential for a limited period of time to have some relaxation in the current measures in place. We're also discussing what we hope can be common arrangements for travel across the UK. It's a big period for people to travel. We are talking about what household mixing might look like. I've seen some of the suggestions kite flying in some reports. We haven't agreed any numbers around that. But I think just as important, if not more so, is that we're considering here in Wales whether we can have a more common approach to measures in advance of Christmas. Because as I've just outlined, we're starting to see in some parts of Wales a rise in coronavirus cases again, an increase in under 25. So we need to get to the festive season. And that may mean that we'll look to potentially think about the measures that Scotland have introduced, as well as England, where they have a tiered system that largely complements each other. So we'll be thinking over the next week about whether we do need to have common approaches as far as possible in terms of how we ask people to go about living their lives, and that may mean that there'll be some changes. We'll think about that as England come to the end of their 4-week lockdown to try to give us all the headroom we want to have the sort of Christmas we want to have together, but to do so in a way that keeps as many of us as safe as possible.
Of course, those approaches in England and Scotland are on a regional basis, aren't they? So is that how you envisage that might work if you were to bring it in Wales? And on a related matter, do you support the decision by Ceredigion and Pembrokeshire councils to close some schools around the Cardigan and North Pembrokeshire areas, in the case of the Cardigan area, for 2 weeks?
Well, my understanding is the schools haven't been closed. They've moved to distance learning, to online learning. So education is still taking place, and it's important to be clear about that. And it's important that local authorities make choices that they think are the right thing for their local population. And I know they discuss these things with partners in the area too. When it comes to the potential for measures in advance of the festive season, we'll have to think very carefully about whether we would have measures in different places in different parts of the country. We saw when we had the local protection areas across local authorities that initially that made some sense, particularly into a distinct action in distinct areas. It was then less coherent as more and more areas had local protection measures introduced. And we did say coming out of the fire break that we wanted to have a consistent set of national measures that would aid understanding and help the public in terms of guiding and supporting choices to reduce our risk. And so we're having to think about that. And so I wouldn't say that we can expect to have a patchwork approach within Wales, but we'll need to consider that, discuss that here with our cabinet, discuss that with our chief medical officer to get the advice from him and our scientific advisors, and to then think about how can we have the maximum simplicity in our message to help people to make choices in their everyday life so all of us can take care of ourselves and each other. Thank you, Felicity. I've now got Adrian Masters from ITV Wales.
Thank you, Minister. Could you say could you assess the nationwide fire break restrictions, and particularly the effect on the NHS? In a large part, the whole fire break was aimed at reducing pressure on the NHS. Has that worked? Is the NHS now under less pressure?
Well, I think I'll start by saying the fire break wasn't just about reducing pressure on our National Health Service. The fire break was actually about trying to, yes, make sure that our National Health Service doesn't become overtopped. But if our health service can't cope, then actually you need to understand that in terms of the harm that's caused to people, because our NHS is very busy at present. We've got significant numbers of people in hospital beds in our National Health. So it's starting to level off, and we do expect we'll start to see a fall in the numbers of people coming into our hospitals. But all of those people in hospital beds are suffering harm because they're ill enough to need to be in a hospital bed. And unfortunately, that also means that a number of those people won't leave, because we know that if we have large numbers of people with COVID in our hospitals, some of those people will pass away. And that's also the point. It's not just protect the NHS, it's actually protect lives and livelihoods too. And within that, it's really important we think about our staff. Our staff went through extraordinary measures to protect us through the first peak. They haven't really had a break. And now, before we get into the normal winter period with the normal flu season circulating, our staff are under tremendous pressure on already having to make choices about which services to run, about expanding our critical care capacity too. So in protecting our NHS, we're talking about protecting the public, but we're also talking about looking after our staff, because we will need them not just for the next few weeks, not just the next few months, but the future of our health service is already here today in the staff we have, and we need to make sure we're doing the right thing for us, yes, our families, but also the right thing for our healthcare staff too.
Thank you. And could I ask you a question about the practicalities of the mass testing that's going on in Merthyr and may get used in other areas? We've heard some concerns about the queues for mass testing, with people worried that that could be a way of spreading disease. Is that a valid concern? If it is, do you share it? And if it is a concern, what steps are you taking to try to alleviate it?
Well, it's been an obvious concern that's been taken account of in the planning. So that's not just about social distancing in the queuing and in the messaging. It's also why there'll be many more centres opened up around the county over the coming couple of weeks. But it's also about the fact that where the current centre is for people who don't have symptoms, if people arrive and they have symptoms, then there's a mobile testing unit for symptomatic individuals too, and people are being diverted away from those queues if they've actually got symptoms. So we're asking people to be responsible when they arrive and to follow the guidance about social distancing, and for symptomatic people to identify themselves, and they'll be sent off and tested somewhere else. But it's near the same site, so you've got the asymptomatic, symptom-free testing taking place, and next to that you've also got a mobile testing unit run by the Welsh Ambulance Service Trust to test those people too. So it's as responsible an approach as we can provide to people to give them the assurance they want. And ultimately, we've managed to identify some people who didn't have symptoms already from the first 2,000 tests or so. So I'm really proud of the team in Merthyr who've worked together at real pace to do this. And I'm also really proud of the initial response of the people in Merthyr Tydfil too, and we look forward to seeing that continue in the coming few weeks ahead. Thank you, Adrian. Now I've got Thomas Evans from Newyddion.
Shwmai, prynawn da I chi, Gweinidog, Iechyd, diolch yn fawr i chi. Just to start, you mentioned the difficult decisions that people will have to make over the next few weeks. Many people will still be in two minds about whether to travel home for Christmas. If they do decide to do that, and if the rules allow for it, what should they do and what can they do to mitigate the spread of COVID-19?
Well, this is about all of us managing our risk. So it is about the number of people you see, the contact you have. If you're moving from one part of the country to another, whether that's within Wales or in other parts of the United Kingdom, then we ask people in particular to think about the length of time they see other people beforehand, or whether actually they can take a complete break from seeing other people before they travel potentially to stay with other family or friends. Because indoor mixing is the area of our greatest concern. So the fewer people you have in your home, the better. And actually, if you can avoid going into someone else's home, the better as well. We know that there'll be people who will stay with family and friends over the festive season. So if you can avoid that sort of contact in advance of that, then that will be you helping to do the right thing. And again, don't forget the basics about social distancing, about good hand hygiene, about wearing a mask whenever possible. If you get symptoms, get tested, because we do know that people are most likely to be at their most infectious immediately before they get symptoms, and then for the next few days afterwards. So that's the time when you can potentially provide the greatest spread to other people. And I know that can be difficult for people about getting symptomatic, and if you like, the wrong time when they want to travel. But if you do travel and you see people when you're symptomatic, you're much more likely to give them coronavirus. I haven't been in my mother's house to be indoors and to give her a hug since March. I'd love to see my mum and go inside her house this Christmas, but I want to see my mum on her birthday when it comes up again next year, and I want to see her on my birthday, my son's birthday, and I want to be able to see her next Christmas too. So some of our challenges are about thinking about what we need to do in a very different way this year to make sure we can still celebrate future life events with our loved ones.
Diolch yn fawr am hynny. And students travelling home for the Christmas holidays will be offered asymptomatic testing. Is that something that you're considering to roll out more widely, and do you have the capacity to do so?
Well, there's a particular challenge and concern about the student population because they're less likely to become unwell, but we do know there's been circulation events in lots of our higher education institutions. It's about giving people confidence they can travel back safely and not represent a risk to their own family and friends who they would see when returning to normally their parental home for the festive season in any event. And that's important. So if there is a challenge, they can isolate and reduce that risk for other people, because of course the traditional undergraduate in their late teens or early 20s may have a much lower profile of risk, not zero risk, but a lower chance of real harm from coronavirus. But people in their parents' or grandparents' generation are much likely to have different risks as well. And so we're needing to think about not just that plan now, and my colleague, the Education Minister, Kirsty Williams, has been engaged in conversations with all the other governments in the UK about this too, together with people in the testing programme in the health department, but also thinking ahead to what might happen when university term recommences in January. And you'll know from the Merthyr Tydfil mass testing pilot that we are considering not just what happens in that pilot, but the potential for further examples of that within Wales. And we're also considering the potential for other groups of staff to have testing programmes in the way that we currently do testing for care home staff as well. This is a fast-moving picture. We need to be nimble and to make choices very quickly, and I expect we'll have more to say on this area within the next week or so. Thank you, Thomas. I've now got Mark Smith from Wales Online.
Thank you very much indeed, Health Minister. During this pandemic, the Welsh Government has repeatedly enforced the message of making plans first and announcing them afterwards. With regard to a Four Nations approach to Christmas, obviously lots of details and suggestions of things like bubble sizes have been reported widely in the national media this weekend, of any formal announcements. Indeed, at one stage, it appeared the Prime Minister was going to outline the details of Christmas arrangements before the devolved administrations had had the chance to discuss the proposals at cabinet level. So therefore, is the Welsh Government satisfied with the way these discussions have been handled? And is there any chance Wales could opt out of any immediate announcement and reveal its own plan separately?
Well, this weekend, the First Minister had a constructive conversation with other First Ministers and Michael Gove for the UK Government. There was clarity and agreement that we want to have as common an approach as possible across all 4 countries because of the reality of people travelling, but also the simplicity in the message so people can understand what's being proposed. And we're hopeful that we will get to as common a position as possible within the next few days. We're also clear, though, following that discussion, that there was a desire to have as common an announcement as possible as well, so people don't go off in different directions. Now, I can't speak for who's briefing around the UK Government, but I know there's been speculation. Our Cabinet meets today. There should be another 4 nations meeting within the next day or 2, and that then may mean that we're at a decision point. If we get there, then we can have that common approach, if at all possible, and also as common an announcement as possible. That's still our expectation, and we're working towards that. And I think people across not just Wales, but the rest of the UK really want all 4 governments to work together on this. So people have the fairest prospect possible of understanding not just what the measures are, but also understanding how you can actually reduce your risk and to think about what the plans you want to make to see people over the festive period in the lead up to it, during the festive period, and obviously there are challenges for all of about what comes afterwards.
Thank you very much indeed. And secondly, you have mentioned this, touched upon it briefly, but what's your message to people on how to behave over Christmas in terms of, obviously people seem to be expecting rules to be relaxed with more households meeting over 5 days or so. Does this mean they can spend 5 full days in large family groups, or would you perhaps be saying instead that there's kind of a 5-day window in place, but that's simply to enable families to meet in smaller groups for, say, 1 meal or a night at some point within those 5 days?
Well, this comes back to our challenge about just talking about the rules or asking people to think of what they should do. And the first point is to get to Christmas, because the rise we see in cases in some parts of Wales is a real concern. And so it's important people think again about where we are now, and that's why we're thinking about as common an approach as possible in the run-up to Christmas as well. And as I say, we'll need to discuss that within the government to consider what the new arrangements might be for England when they come out of their 4-week lockdown next week. So we'll need to think carefully about that and to think about whether there's value and benefit for all of us to have, if possible, as common an approach as possible across all 4 nations in the run-up to the festive season. Then whatever the rules say, we're still going to ask people to think of what they should do. You know, we're looking to reflect the reality that people, if the rules said you can't meet anybody else over Christmas, people would do it anyway. And we're not looking to have people potentially commit offences for the natural issue of wanting to see people around this period of time, but to help people to shape some of that behaviour and to again think about what should I do. And your point about we're not asking people to live in large extended household groups for 5, 3, 4 or whatever the period of time is that we land on. It's more about this is enabling people to have some contact, but it's still then about managing that contact and reducing it as far as possible and reducing the length of time as far as possible as well. So again, to think about you and me and who we'd want to see over this Christmas, but also think who would we like to see again and again and again in the future, and not to have the unnecessary risk of losing those people if we're not prepared to be responsible and to limit the contact we have in advance of Christmas, during Christmas and afterwards too. Thank you, Mark. We've now got Rebecca Miles from LBC.
Thank you, Health Minister. So we have heard more positive news this morning about another potential coronavirus vaccine. We know that with the Barnett formula, Wales will get its population share. You've previously said, as a population in Wales, we're older, sicker and poorer than that we see in England. So potentially more vulnerable people here. Should the allocation not be based on a need, and are we going to have enough?
Well, if we wanted to unpick and have new arrangements to agree the basis on which we'd provide vaccines and moved outside the population share that Barnett sets out, I think we could very quickly find ourselves mired in difficulty. That mean we couldn't have an understandable basis to have the vaccine provided. And of course, if we have a series of vaccines that meet the regulatory approval and are safe and effective to use, then we should have enough to have population coverage across the whole UK, including here in Wales. So we will get a fair share, that's guaranteed. The Welsh Government has already been clear. I've decided that we'll use the expert advice from the Joint Committee on Vaccinations and Immunisation to help target who will vaccinate first to protect people at the highest risk. And we should get to a point where we can have that population coverage to provide a significant measure of protection. But the message for today has to be that hope is in the future, and we have several months before we get there. So again, not to lose sight of our behaviour and our choices today.
On that behaviour, we've heard superspreader events, so-called superspreader events, parties, pub crawls have been blamed for a big rise in cases in parts of Ceredigion, with around a dozen schools that are closed and in Pembrokeshire. So what's your reaction to this? And you mentioned about potential more local rules. What would they look like?
Well, we're thinking about whether we should have something that is more common to the approach that's been taken in both Scotland, England, and to an extent in Northern Ireland as well. So thinking about would there be benefit for all of us in having a more common set of measures in advance of Christmas, because I think that would really help with the message for the public and to get us to the point where we have more headroom for the festive season when we know there will be more mixing between different groups of people. The challenge again for today is to not think that we can go back to the old normal, whether that's the middle of the summer when coronavirus was successfully suppressed to a very low level, or indeed before the pandemic at all, because that has real consequences for the spread of coronavirus and the harm that it will inevitably cause. And again, if you're a young, fit, healthy adult, you may consider that you don't have a great risk, but we know that people don't live their lives in that sort of segmented way where only young people see only young people. We're talking about university students going back to see their families primarily over the festive season, over the break at the end of university. So people do mix across different age ranges, and that's why we haven't gone for an approach to essentially ask older people to lock themselves away. Some people have said that's what we should do. We've said we don't think, A, that's fair, but also it doesn't reflect how people live, and that's why we're not taking an approach of shielding people in the over 60s group and asking them not to live their lives in the same way we're asking everyone else to make choices about reducing your contact with other people, reduce the time you spend with other people, and it's for all of us to take on our own share of responsibility to, yes, look after ourselves, but also to take care of each other and to recognise the choices we make will continue to have a significant bearing on how many of us are left to enjoy the future at the end of the pandemic. Thank you, Rebecca. Now I've got Harry Evans from the Daily Post.
Gweinidog. Do you have any updates on the situation at Llangollen, Vaughan, care home?
Not a specific update, but if you're looking for a specific update, we can talk with both the local authority and the regulator, Care Inspector at Wales, to see if we can provide you with a specific update if that's what you like. If you do, then please get in touch with us here and we'll provide that for you in the Daily Post.
Diolch. And how can you assure people that care homes are safe places for their family members to be over the Christmas period?
Well, that's why we're piloting some measures now. So there'll be care homes in every health board area of Wales, so we'll get coverage across the country. We'll be using the lateral flow devices that are being used in Merthyr to identify new cases. People are asymptomatic. And it's about giving confidence both to the providers and the staff in the care home, but also to family members and loved ones themselves. Because a lot of them have not visited, even though they've wanted to, and not tried to visit because they're concerned themselves about potentially causing harm to loved ones in that environment and other people that they share that care home environment with as well. So the tests and the pilot will help us to understand not just about whether a safer visiting process is possible, but also about how we could roll that out across the country if the pilot does show that it's safe to do so. And we know that this is part of a really difficult challenge, isn't it? On the one hand, we're protecting people in care homes and we know that coronavirus gets in by staff or by visitors, and they're the common ways that coronavirus can get in, or by new admissions from outside the care home. If we're going to do something about that, then we need to think about how can we have a process that protects people as far as possible and manages all of those different risks. So the pilot is good news for everybody in Wales. We'll also have additional learning from the piloting that's taking place in England too. So not just visiting to put people at risk, but a safer possible way to visit and have some contact with loved ones. And that goes alongside, of course, the measures we're taking to help care homes who can't do it themselves to create a different sort of environment for visits that could take place in the future. Thank you, Harry. I've now got Rob Taylor from Wrexham.com.
Good afternoon. 2 weeks ago, the First Minister said he'd been told the latest outbreak at Wrexham's hospital was under control and small. The latest update on Friday had cases up to 49 from 20 the week before. Is it still classed as under control?
No, there is an active infection that's being managed, an outbreak in the Miler, so it has got worse than where it was 2 weeks ago. We've seen another recent respike, so we're looking to understand exactly what's happening and the measures being taken. And again, Rob, this really highlights this pernicious infection. It's highly contagious, and if you think you have it under control, then a breach to our defences can lead to significant harm very, very quickly. And with community transmission rates as high as they are today in most parts of our country, and that's why it's so important for us all to take the right steps. So the points about face coverings, about hand hygiene, about keeping our distance, and it's also what's so important for people to make use of PPE in different settings and those really strict infection prevention control measures. Even with all of those happening, with the level of transmission taking place, it is still possible that we'll continue to see outbreaks in our hospitals, and that's why we're all looking to see how far can we suppress coronavirus, because otherwise it will cause harm in each of these closed environments.
Thank you. And given the rise in cases in schools, in particular secondary settings, and new evidence suggesting it's more widespread than first thought, will Welsh Government look to close schools earlier this year for Christmas, given a period of time before Christmas to create a buffer period?
Well, we're thinking about the variety of different measures, as I said earlier, and we're having to talk about the harm that comes from school closure too, because as I say, we know very, very clearly that not having schooling take place in the way that it didn't for nearly 6 months caused real harm, in particular to secondary school learners, and that's both the harm in the immediate period, in particular the impact on mental health and well-being, but it's also the loss of educational achievement as well, and that has really significant consequences for people's futures. The good news is that, of course, even teenagers are less likely to suffer significant harm themselves. You'll have seen the new measures that has been taken and announced by the Education Minister today on face coverings. And you'll also see that the way that schools are organised, it demonstrates that our staff are not in a high-risk profession. And that is because the effective social distancing that is taking place within our schools. It will, of course, continue to look at the evidence, and I'll be particularly interested, together with the Education Minister, to see what results we get from the testing around the 3 high schools and the college in Merthyr Tydfil as well. There'll be lessons there for the whole country, and we have a range of measures to consider in advance of the festive season as well as afterwards, Rob. So rather than giving a running commentary, we'll look to think about the measures that we think we need to put in place to protect everyone across the country, and as soon as we're in a position to do so, we'll of course to make that clear to both the Cynhadledd and the public. Thank you, Rob. We now got Andrew Nuttall from The Leader.
Thank you, Minister. What evidence have you got that sort of says the firebreak in Wales, or is there evidence that the firebreak in Wales has given the best chance for people to be able to see their loved ones over Christmas in a way that they would sort of prefer? Obviously, given that the announcements that are due to be made regarding Christmas celebrations.
Well, in the slide we had last week, we showed a very sharp decline in the number of new infections. And so we're starting to see that as part of the impact of the firebreak. That will eventually feed through into what we expect should be a period of reducing admissions into our hospitals. And we're starting to see a levelling off in the number of admissions into our hospitals here in Wales. And we haven't seen that a significant and continued rise in hospital admissions. That's really important to give breathing space for our National Health Service. So we have got good evidence the firebreak has been effective. The challenge is what we're all prepared to do now to make sure that we can get to Christmas and have a period of some relaxation, because as I say, we know that even if we had rules in place to try to prevent people seeing their loved ones at Christmas, a range of people would do that anyways. This is the difficult balance in trying to help people, to shape choices, to reduce risk as far as possible. But to get to Christmas, that's why we're having to think about the potential for alternative measures and to think about a consistent way potentially to do that, for choices we might make in Wales to have that approach that, as I say, Scotland and England have a broadly similar and common approach, and so we'll need to think about that too.
Thank you. And it's been touched on previously with the case in Llangollen in the care home. But we've been sort of inundated with messages from people sort of having similar worries about their own families in different care home settings. So what can your sort of message be to people with family in other care homes that have similar worries, because it made for a bit of an unsettling read?
Well, it's a significant concern for ministers and officials here in the Welsh Government too. We know that, as I said at the start, if coronavirus gets into a care home environment, it can cause real and significant harm, and very quickly too. That's why the focus on infection prevention and control measures, on PPE, on having the regular staff testing programme, and of course on good ventilation across those environments is really important. And it's then up to all of us to think about what we do. Because in the choices we make, we don't necessarily consider that the choice we make and how many people we see may have an impact in a care home, and yet actually high levels of community transmission mean harm is much more likely to get into our care homes because the staff live within the rest of the community with all of us. And so if you have high levels of transmission in the community, there's a heightened risk of those people going into the care home environment too, even with a regular testing programme. So the choices we make matter for everyone that we see and for people we may not understand we're having a contact relationship with, who may work in different environments. So all of us need to consider our choices. We'll continue to do what the evidence says we should do. We'll continue to provide as much confidence as we can for the care home sector, for staff working in that environment. But also, as I said earlier, the pilot for visiting, the rapid testing should enable some visiting to take place, and we should learn a lot from that pilot in the 15 care homes that will take part in it here in Wales. Thank you, Andrew. And now I've got Tom Magner from Carers World.
Thank you, Minister. You mentioned earlier on about taking technical advice on who should be vaccinated first. Public Health Wales has published an interim list of vaccine eligibility. Viewers who've been looking through it say, well, it doesn't seem to mention unpaid carers. It's simply a list of age bands getting younger. Shouldn't unpaid carers be ranked alongside NHS staff and care workers, especially, some suggest, those unpaid carers visiting a friend or relative in a care home?
Well, that does depend on the risk profile of not just the carer, but the person they're caring for as well. And that's what makes it rather more difficult to have a whole categorisation for every single unpaid carer. And so that's part of the challenge we'll need to work through. And there'll need to be conversations, not just with Public Health Wales about the advice they give, but then to look to give clarity to people that can understand that it's fair. Fair to those people who aren't carers, but are nevertheless in a different risk group, but equally fair to those people who are carers with their additional responsibilities and the risk not just for them, but for other people they're caring for as well. So I do recognise fully the point you're making, Tom.
Thank you very much for that. One of our viewers in Ceredigion has come up with what may seem to be a radical idea about vaccine prioritisation. At first, she says, obviously, NHS and social care staff should be first, naturally. But then she says, shouldn't the illegal party goers, the Superspreaders and those flouting the rules be vaccinated next in order to protect all of us? I'd be interested in your thoughts.
Well, the couple of immediate challenges that spring to my mind, Tom, are that for those people who are in higher risk groups of harm, they may not think it's fair to deliberately look for people who are not being responsible, provide them with the vaccine. Because actually the first iteration of the vaccine should really be about protecting people at the greatest level of harm to save lives. And if we chose not to do that, those people would potentially still be at risk with community transmission levels at the rate they are. The second point also is that, of course, not just the messaging for those people and everyone else who may not think that's fair, But if we ask people who are undertaking riskier behaviour and ignoring the rules to come forward for a vaccine, I'm not sure we'd have a significantly positive take from people who would volunteer. They've essentially been breaking the law or not behaving in a sensible way. So if you could pinpoint some of this, you'd have a range of different choices to make. But I don't think I'm giving any secrets away to say that that isn't going to be the approach that we're going to take in the Welsh Government to help keep the whole of Wales safe. As ever, thank you for your questions, not just Tom, but everybody today, and I look forward to seeing you again in the near future. Take care.